Hi, my name is Anthony. So I just wanted to talk to you a little bit about person-centred care, which is one of the breadth of what the people in the workforce do here within the NHS, especially working in an environment with direct patient contact. Person-centred care works really, really well just to improve the recovery of patients and just patients to feel at the centre of their care. I've essentially delivered this in the hospital to one patient that kept on forgetting to take her diabetic medication. So she forgetting to take that medication, so her sugar levels would always be exceedingly high, and she had a really poor diet of having high sugar, which is not going to help her glucose levels as well. So what I actually thought about this patient is to find out the reasons why she's forgetting and show her how we can sort of help her to manage to take her tablets. One of the things I suggested is go on her smartphone and just start putting reminders of when to take the pills first thing in the morning, and also the other times that she's also got to take them as well. Also referring her to a dietitian, talk about different ways, healthier ways of eating. She mentioned that she loves to have drink and she loves to drink like champagne, Prosecco, but I said to her that obviously these drinks, essentially alcohol, is high in sugar. So I told her that maybe there is sort of alternatives like Schlur. So maybe you could do juices and add in some like just soda to it. And even if she really just feels like a drink, there's also places that she can get zero alcohol drinks that kind of give the similar taste, but not to have too much of those. So I just showed her the alternative. So really just making it the center of what is best for her health, really, essentially. And also just to know that reminders of taking her tablets is very, very important as well. And I think what patients love is that you want to tell them to do the right thing, but you also want them to be at the center and just adapt and ways and think of resolutions, essentially, when people are forgetting to take the medication, and just the best way to care for them. And also some people do need that extra support. So what's also good is what I offered her is make sure that a community nurse will do regular visits on a weekly basis to check up on her, because I don't want a patient come back into the hospital with the same problems or even worse, which can be prevented. So thank you for listening, and I hope you've got an overview of what person-centred care means, and it's great because it's personalised to you, and you essentially will recover better as well.